Hello everyone, this is Jin, a TCM practitioner and instructor in Victoria, BC, Canada. Here is my online class for Acupuncture Case Study. The book we use I put below. I hope I can help the students study and review for the class. Okay, let's start.
Okay, let's discuss together. Unit name. Unit name for this one. Yeah, 痹症 is good, and painful obstruction is still good. Yeah. So this patient chief complaint is joint pain. They didn't talk about usually when we go to diagnosis for common cold. We talk about the patient maybe fever, maybe headache, maybe running nose. So that's the kind of picture there. We make a diagnosis for common cold. If there are chief complaint there. But these patients' chief complaint is joint pain. So that's basically we focus on chief complaint. We are not necessary for the common cold there. It is there are some symptoms relationship with EPI evading, but not the whole picture go to there. Let's see what's the symptoms there. Okay. Yeah. Very mild aversion to cold and some headache, sore throat. One week ago, bad cold with aversion to cold, fever, and sore throat. So look like mainly problems is joint pain. So that means we are not necessary to diagnose it for common cold. Yeah, it is some EPI evading, but cause the mainly problems is joint pain. So we only diagnose it for the, we can say B syndromes or maybe painful obstructions. Okay, your pattern. Yeah, wind heat. Yeah, wind heat. So that's the pattern, wind heat. So that's we can explanation like other symptoms there. So basically, let's talk about the B syndromes. If we talking about the B syndromes, we talking about we have wind B. So wind B basically is moving. Yeah. Painful situation is moving around. That's wind B. We have cold B. Cold B is more painful. And we have damp B. Damp B is more heavy. And then we have heat B. So heat B is swollen and runny, feel hard locally. So look like this patient is not that heavy sensation, like usually we talking about maybe all over the body and maybe locally. And also, like the pulse and the tongue, we didn't see like a dumbness size in there. So we only see swollen here, swollen here. But we didn't see other signs. But these kind of swollen, I believe that belong to, if we're talking about the B for this one, it should be go to heat B. Yeah, become swollen. And they have some heat signs. Yeah, they're only talking about swollen locally, but symptoms we didn't see. We didn't see the like a heaviness, and we didn't see damage signs in the tongue and the pulse. Yeah, rushing and nodules. Yeah. Skin rash. Yeah, that's the good aspect that we discussed. Yeah. Yeah. Skin rash. What's the common reason cause the skin rash? Uh, Skin rash basically, yeah, we have two reasons. One is external reason. Yeah, it's wind. Yeah, wind and heat. Yeah, that's wind and heat. So basically, yeah, yes, yes. So that's caused by wind heat in here. Yeah, and the nodules here. What do you think about the nodules? Yeah, usually we're talking about the nodules. Can be caused by phlegm, can be caused maybe blood stasis, but generally say it's the obstructions. Yeah, generally say it's obstruction. Yes, blocking obstructions. Yeah, flow fluid and the heat in the local area, blocking there. Yeah. So far, yes, you are right. Yeah, yeah, there are locally stagnation blocking for long term already from arthritis, and then with the heat invading and make it worse. Yes, you are right. Yeah. Uh, so basically, pattern we're talking about wind heat pattern. If some other symptoms we need to discuss here, what do you thinking about the patient thirsty and desire to drink, scanty yellow urination and dry stool here? Yeah, it is heat. Yeah, it is heat. And the heat consuming body fluid. So basically, this case, yeah, we're talking about EPI wind heat. Yeah, that's our pattern here. EPI wind heat usually not caused like thirsty and desire to drink or even scanty yellow urination and dry stool. That's kind of internal heat symptoms. But this kind of internal heat is coming from external, means external heat go to deeper and then damage body fluid. and heat inside. So for this kind of case, we still try to relieve external. Like we say, the pulse still slightly floating here, and the patient like have aviation cold and a fever here. So means external symptoms still not totally relieved. So basically, this kind of patient, after we relieve externals, internal heat will be gone away. But truly, the heat go to a little bit deeper, cause some internal heat already. Because that's 1 week, 1 week after, 1 week after. So we say EPI, whatever EPI wind cold or EPI wind heat, if not cured in the superficial level, they can go to deeper and changing to internal heat. Even EPI wind cold blocking there can change into heat also. And certainly wind heat is more easily changing to internal heat. Okay, so that's good for our pattern here. So the treatment principle, at first wind and clear heat, moving tea, stop fan. Yes, that's good. At first wind, clear heat, moving tea, stop fan. Yeah, that's good. Basically pretty similar. The book, pretty similar for the book. So at first, wind heat, and then they talking about cold blood. On the book, we talking about cold blood here. I believe that's because some ski rushing there, that's the wind disturbing the blood and cause some blood heat in there. So that's we talking about cold blood. That's some relieve some internal heat. And then remove obstructions from the channel. Stop it. Remove obstruction. Stop. Okay. That's on the book. Pretty similar. That is special talking about the cooling blood. But without cooling blood, we still good. So that's the treatment principle. And what's the points you use? The points. Bladder 17, bladder 60, gallbladder 20, gallbladder 34, gallbladder 40, that's good. LI4, LI11, good. Stomach 35, CM, good. Spleen 10, good, yes. LI4, LI11, Sentinel 5, yes. Liver 2, gallbladder 35, bladder 63, yes. Blood 20, stomach 34, good. Yeah, spleen 10, gallbladder 34, 500, 11, stomach 25. Yeah, 独鼻. Yeah, I think where the location of Dubai. Okay, yeah. Yeah, that's good. Yeah, yeah. Yeah, that's good. Yeah. So let's see what's the points on the book. Yeah, points on the book. So gallbladder 20, that's mean the points. The gallbladder 31, still win the points. Yeah, still win the points. The sprinter, that's moving some blood. Yeah, moving some blood, and also close to the knee. That's they talking about cooling blood. Yeah, cooling blood and moving blood. Yeah, that's we have in there already. And LI11, we say this case we are not diagnosis for internal heat, but truly have some internal heat symptoms there already. So that's LI11. And CI, CI is on the knee, yeah, on the knee, close to the knee. Mainly treat the knee problems. And another actual point we call 鹤顶. That's on the top of the knee. That's another actual point. Still treat the knee problems there. And then they use bladder 60. Yeah, pretty similar there. Yeah, yeah, we can bleeding bladder 40 there. Yeah, it's some internal heat in there. Yeah, we can bleeding there. Yeah, if local too swollen, we try to not direct the needle there. Yeah.
Jen,
Yes.
what is like too swollen? Because like in clinic, I'm pretty apprehensive about needling into like any swollen tissue.
Mhm.
Like what's appropriate?
So basically, we try to needle locally, just in case cause the inflammation go to deeperly. So that means if they have the inflammation size in there, like redness or even local broken, and local more heat and some kind of inflammation like bacterial infection size in there. But if their skin like not broken and no typically like ulcers in there, basically it's safety to needle it. We just try to avoid to needle like bring the bacteria too deeply.
Okay, and like if it's not like warm to the touch, so if it's like hot, like when you feel it, do you want to avoid it also?
If only feel heat, still okay.
Okay,
But if you just touching and the patient very painful there, we are not directly needle there.
okay,
Yeah.
okay. Thank you.
Yeah, you're welcome. Yeah, so that's the points here on the board. Looks everything okay for this case? Yeah.
Jen,
Yes.
I'm curious about there are so many acupuncture points, and when it comes to the board exam and they're asking for 5 points only, how do we, at least as far as like marking goes, how strict are they with no, you can only say these 5 points, or there are a variety of points and you have to choose within those 5. Do you know about the process?
So basically, you choose the points. You need to match your treatment principle. Like this case, with a treatment principle, we can put like a number 1, number 2, number 3 here. So that means you need at least 3 points. You need matching it. So relieve, express, mean the heat. You can pick up 1 point, especially go to there. So like we talking about wind points, we have like a gallbladder 20. That's usually pretty commonly used. Yeah. And that's like 1 point in there. And cooling blood, we need 1 point. So for this case, in the book, they use spring 10 here, working for the blood. We're working for the blood. And remove the pain, stop pain. These patients, especially for the knee, so that's why we got some like xian there. So certainly if we say we try to use 5 points, we can add another 2 points, like maybe more go to express EPI with the heat because that's the mainly cause, or maybe we add another point, mainly focus on local pain. But pay attention, your points need to cover all of these 3 aspects. Like your points need to cover your treatment principle. You couldn't put the points only experience with the heat here, but no points for other 2. So that's the ruler you pick up the points. This makes sense?
Yes, thank you.
Yeah, so that's we say when we make points, we can make a group of points. Yeah, we can make a group of points. Basically, cover your treatment principle there.